Ironically, fact-checkers often commit the same errors they accuse others of. So when Reuters fact-checked one of our articles on Facebook and had it removed, I discovered factual errors in their fact check. You won't want to miss how these purported actuaries and supposed independent agencies spin the facts to fit a certain narrative. Let's dig in. Several weeks ago, an article we posted citing a study on all-cause mortality was fact-checked by the big pharma-backed fact-checkers on the social media policing platform Facebook. The article was titled COVID-19 Vaccines Linked to Excess Deaths, but did not originally have the question mark after the title. Our article cited research from the British medical journal, the BMJ, whose authors found that COVID-19 containment measures in COVID-19 vaccines may have detrimental effect that cause inferior outcomes, saying that it's noteworthy that excess mortality during the crisis points to a more extensive underlying burden of disease, disablement, and human suffering. It even went on to say that although COVID-19 vaccines were provided to guard civilians from suffering, morbidity, and mortality by the COVID-19 virus, suspected adverse events have been documented as well. The Canadian government acknowledges that through the VISP Vaccine Injury Support Program. They base the analysis on placebo-controlled Phase 3 randomized clinical trials of mRNA COVID-19 vaccines, so that's Pfizer and Moderna, finding that serious adverse events lead to either death, are life-threatening, require inpatient prolongation of hospitalization, cause persistent significant disability, incapacity, concern a congenital anomaly, birth defect, or include a medically important event, according to medical judgment. That seems pretty self-explanatory, yet Reuters published this nonsense fact check claiming that the study does not say COVID-19 vaccines may have fueled excess deaths. Some of the facts that they used to prove this are as follows. The researchers looked only at trends in excess mortality over time, not its causes, a statement from BMJ Public Health said. So they didn't actually look at the causes, but of course it couldn't be the novel mRNA injections that have never been mass-produced or mass-injected into the entirety of the global population before. Nope, it definitely couldn't be those things. Reuters further states that public health data scientists told them that the paper did not establish a link to vaccines and said it actually showed excess deaths had begun falling in 2022. But that's not entirely true. Here's what Houston-based Frontline COVID-19 Critical Care Alliance, the FLCCA, founding physician Dr. Joseph Varun, who treated patients throughout the COVID hysteria, had to say about the persistent increases in all-cause mortality, especially in highly vaccinated countries.
Normally, every country has a, let's say, certain number of people that die every year. You know, that happens all over the world. Then when you look at the data, the last 4 years, suddenly we have an exponential increase in the number of deaths. Well, you would say that's because COVID hit. Well, that's not necessarily true. Because when you look at what happened to the COVID mortality, it actually went down. So you say, why is this excessive number of deaths going up? And it is fascinating to see that that correlates with the rolling out of the mRNA vaccines. Now, you may not want to believe it. Your fact checkers may want to say, this is not right. I mean, I'm just putting it out to people to make up their own educated decisions. If you see that something is going up at the same time that you release a new agent, to me, common things are common. But there is even one more interesting data, and that's something that Professor Paul Marik discussed. We were talking to him the other day. And, you know, one of the countries that had the largest number of people vaccinated was the country of Portugal. Well, Portugal has the highest mortality now after the rollout of the vaccines of any country in Europe. That, if that doesn't show cause and effect, I don't know what else does. And yes, your fact checkers probably will tell you this is not true, but like I said, just look at the data and you make up your own mind. I already made up my mind.
If you look at Figure 1 of the study, excess deaths began to decline in the first quarter of 2022, then rapidly increase again in December of that year. In fact, the study repeatedly notes that preliminary and incomplete all-cause mortality reports are available for 2022, meaning that the final numbers are, in part, yet to be determined. Figure 3 further confirms this, with all-cause mortality seeing a marketable jump in December of 2022 in 6 countries in the Western world: Australia, France, Germany, the United Kingdom, and the United States. As pointed out by John Campbell in the UK, excess deaths continue to persist into 2023 and 2024.
Now, starting off with the graphic of the United States, from 2020 all the way through to 2024, we see consistent excess deaths. High in 2022, a little lower in 2023, looking like a lower in 2024, but these are still around about 4 to 5% figures. Just to give a bit of a blow up there, we can see the numbers have been high, even as high as 20% there, but consistently in 2023 we see well over the 10% mark. Let's hope this downward trajectory here continues. United Kingdom, again, this is the 0% line, so we've been above excess deaths, or what we would expect for excess deaths, pretty consistently in the UK. And then again, looking at it more closely, we can see that from 2022 we've been often well above the 10% mark, and round about the 8% mark at the moment, still persisting. Australia, high excess deaths in Australia, still around about the 15% mark we can see there, unfortunately. Now, Australia is, as far as I know, the only country in the world to have an official investigation into excess deaths. We are going to hopefully be looking at that again shortly. Other countries don't seem to be bothering. And it's not a topic for mainstream media discussion either. It really is quite bemusing that all these extra people are dying, and yet, I don't know, but people in denial about their own mortality. I can't really quite explain.
As he points out, on a country-by-country basis, Canada is still seeing consistent increases in excess deaths, well above the 10% give or take baseline for excess mortality projections.
Canada, well, dear me, still carrying on increasing in Canada, up to about the 25% mark at the moment. One gets the impression there are really quite significant problems on a number of levels in Canada.
So while excess mortality has been declining, it still hasn't come back down to pre-pandemic and novel injection rollout levels. That is a fabrication and only a half-truth on part of the fact-checkers. Nonetheless, the fact-checkers assert that according to the World Mortality Dataset, which tracks the impact of the pandemic, excess mortality fell to 175,000 in 2023, and this somehow contrasts with the Telegraph headline, and thus Rebel News' headline, suggestion of a continued rise in excess deaths. But again, excess deaths are still well above projections in many nations across the globe, marking this as a global phenomenon and not exclusive to 1 or 2 countries. It's definitely worth looking into. The fact-checkers source Stuart McDonald, who self-identifies as a COVID actuary, as the deputy chair for the Continuous Mortality Investigation. Here's how the Institute and Faculty of Actuaries describes what this means.
An actuary tries to predict the future, and that's a really difficult thing to do. And the only way that people have come up with so far is to look at what's happened previously.
The kind of technical answer is we use statistic to kind of like help manage and measure risk. But I think what we actually do is explain things that are really complicated to people and try and make it as simple as possible.
So it uses data, analyzes the past experience, and predicts the future based on judgment, based on what's currently happening in the economy, for example, the interest rates, inflation.
Actuaries are needed where there's something that can't be measured or counted. So for an insurance company, how much money does an insurance company have to set aside to be able to pay out to all the policyholders if something happens, or how much money does a pension scheme need to put aside to be able to pay benefits out to its members.
After disregarding vaccines and lockdowns as culprits in this continued concerning trend of increases to excess deaths globally, he says one would need to explain why the highest vaccinated countries, and then he lists New Zealand, Denmark, and Australia, had the lowest excess deaths. Except one look at the data shows those countries had upwards of 80% compliance with the double doses, with still notable increases in excess deaths that persist to this day. He says that the least vaccinated countries, for example, Albania, Bulgaria, Serbia, and Montenegro, had the highest excess deaths. And it's true that those countries had low vaccine uptake, hovering around 30 to 40%. All of their excess deaths relate directly to lockdown measures and supposed waves of infection in 2021. But the data clearly show that excess mortality has since returned to normal and has not continued to persist into 2022, 2023, and 2024. This is in stark contrast to those other highly vaccinated countries, New Zealand, Denmark, and Australia, as you can see in this screenshot of the data shown here, where excess deaths continue to persist. COVID actuary McDonald says that excess deaths coincide with COVID deaths, but Our World in Data says that due to varying protocols and challenges in the attribution of the cause of death, the number of confirmed deaths may not accurately represent the true number of deaths caused by COVID-19. So how can he confidently make this claim? I reached out to the fact checkers to ask this and other relevant questions. My email was addressed to Reuters fact-checking unit. Yes, there's an entire unit. Brian Moss, the editor, ethics and standards at Reuters, and Stephanie Burnett, the head of Reuters Fact Check. I introduce myself and note that their fact check affected one of Rebel News' written pieces, which I took the liberty to fact check and discovered some of these factual errors I've already listed. I let them know that I would report critically on this and provide them with an opportunity to clarify the following. 1, how was actuary Stuart McDonald chosen as the expert on this? 2, who was responsible for fact-checking his claims? 3, what steps does the fact-checking unit, as a signatory of the Poynter Institute's International Fact Checkers Network, which receives hefty government grants, take to ensure fact checks are at arm's length from government narratives and messaging? 4, the success of the IFCN is further linked to complex relationships with vaccine profiting organizations. How do they ensure the impartiality of pharma-related fact checks if pharma funds this operation? And finally, why does the article not differentiate between a rise in excess deaths and the persistent increase that continues throughout 2022 and 2023? A Reuters spokesperson did respond. The response came from Heather Carpenter, Senior Director of Communications at Reuters, who stated that Reuters is committed to reporting fairly, accurately, and independently in keeping with the Thomson Reuters Trust principles. We stand by our reporting. A similar occurrence happened when I was first fact-checked last September by purported independent fact-checkers who are heavily intertwined with big pharma funders and vaccine profiteers. They were guilty of the same thing they claimed I was incorrect for, being misleading, cherry-picking, and of course, bias. So who's responsible for fact-checking the fact-checkers and ensuring their impartiality, especially when their assessments influence public perception and discourse? With entire units dedicated to this censorship and manipulation of public opinion, it's clear that we cannot trust the integrity and objectivity of fact-checking organizations. For Rebel News, I'm Tamara Ugolini. These self-proclaimed actuaries and fact-checkers are similar to Prime Minister Justin Trudeau's hand-picked censorship panel, declaring Rebel News not a real news outlet, but we're fighting back. To learn more and support us in this legal endeavor against the feds, please visit wearesuingtrudeau.com. That's wearesuingtrudeau.com.